Today's chapter 5 is all about models and frames of reference. We know both a model and a frame of reference is based on theory, and they're a way to help organize knowledge. A model more integrates theoretical assumptions for use in practice. It's more a way to structure and organize information that is relevant to practice, and it guides thinking. Whereas a frame of reference is more specific than a model in terms of application of knowledge and information. It kind of organizes information in a way that can be applied with your clients. So a frame of reference tells an occupational therapist how to use information in practice. The first frame of reference we want to go through is the behavioral frame of reference. So basically, this frame of reference states that a person's behavior is the result of feedback from the environment. So insight and personality are not necessarily considered. And this frame of reference believes that a person can unlearn maladaptive behaviors. So if you're doing documentation through this frame of reference, your eval should contain detailed observations of behavior, descriptions of the behavior, how often it happens, where, when, and under what circumstance the behavior occurs. When you're documenting progress reports under the behavioral frame of reference, it should document behavior modification methods used and the results of these interventions. And if you're writing goals under the behavioral frame of reference, you want to make sure they're specific to the person, they're observable, the conditions for the behavior, such as where, when, frequency, and any cueing that will occur, you want to make sure to write those down. Next is the biomechanical frame of reference. So the focus of the biomechanical frame of reference is that the body is a machine, quote unquote, and by using this frame of reference, you want to improve strength, endurance, and structural integrity of the body, and they believe that that will lead to improved function. So when you're documenting through this frame of reference, your evaluation, the report should focus on performance skills and client factors. When you're updating and doing a progress report, the progress note should reflect improvements in range of motion, improvements in strength, reduction in edema, and improvements in endurance. So goals for under this frame of reference should go along with that. It should be with range of motion, strength, edema, endurance. Functional goals will reflect new activities that will increase movement to happen. Next is the Canadian Model of Occupational Performance, or the CMOP. So this frame of reference believes that the person is in constant interaction with the environment. It focuses on client-centered practice and spirituality. They believe it gives meaning to occupations. Environment is influences occupational performance in this frame of reference. So documentation under the Canadian Model of Occupational Performance, you'd want to, in your evaluation, focus on activities of daily living, play, spirituality, and work. And your progress reports should focus on the client's ability and satisfaction in performing meaningful occupations. And the goals, when you're writing goals under the CMOP, you should be relating the goals to ability and satisfaction in performance of meaningful occupations to the client. So under cognitive behavioral therapy, this frame of reference, we believe that maladaptive behaviors are the result of cognitive distortions and self-defeating thinking. So people are taught to repeat positive self-talk and to alter their core beliefs. In documenting under the cognitive behavioral therapy frame of reference, since we are focusing on how maladaptive behaviors are because of these like bad self-defeating thinking patterns, our evaluation reports should focus on the client's report of their occupational problems and insight into barriers of occupational performance. Progress reports under this frame of reference should note the client's report of feelings and thoughts, skills and attitudes and context which lead to changes in behavior. And goals under this frame of reference should suggest positive statements the client will repeat to oneself. You should use stress management techniques and identify what they want to get out of this, so desired behavioral outcomes. The cognitive disabilities frame of reference, or the Allen Cognition and Activity frame of reference, states that neurological problems lead to limitations in cognitive capacity, which can lead to performance deficit. Documenting under this frame of reference, your evaluation report should identify the current cognitive level as supported by functional performance in everyday occupations. Your progress report should describe the client's response to adaptations in the task or environment, or any changes noted in cognitive level based on your observation. And your goals under this frame of reference, they're established to identify desired performance within the context of the client's environment and relate to any type of treatment you would be doing. The developmental frame of reference, which basically just states that humans normally develop in a very sequential fashion. And when you're documenting under this frame of reference, evaluation reports focus on comparing a child's performance to that of a typically developing child of the same chronological age to identify what areas they need intervention. Progress reports under this frame of reference show the child has made gains in functional performance of daily occupations. And then your goals to be written under this frame of reference, they should identify desired occupations to enable the child's maximum participation in life situations. The model of human occupation states that volition, habituation, and performance are interrelated subsystems within a person that regulates choice, organization, and performance. Personal and environmental factors influence these things as well. When documenting under Model of Human Occupation, or MOHO, your evaluation report should focus on the client's performance in the areas of occupation, interests, motivation, habits, and roles. Your progress reports or progress notes should focus on the client's choices, habits, and roles during meaningful occupations. And your goals, when you're writing goals under MOHO, they should relate to performance in meaningful occupations and habits and roles. Next is neurodevelopmental treatment, which is also known as NDT. So NDT basically states that spasticity and hypotonia are the major barriers to normal movement. The trunk and proximal joints need stability in order to enable limb movement. It also believes that the brain is plastic and capable of new learning. So under this frame of reference, work towards inhibiting abnormal reflexes and synergies to enable learning of normal movement. You focus on, bilateral movement using positioning, handling, and sensory stimulation to facilitate normal movement patterns. In documenting under NDT, your evaluation report should focus on observations of movement patterns and barriers to normal movement, and your progress reports need to reflect frequent clinical observations about these patterns of movement and barriers to normal movement. And then your goals need to relate to the pattern of movement that enable occupational performance. So you want them to be as functional as possible. The Person, Environment, Occupational Performance Frame of Reference, or the PEOP, it states that many intrinsic and extrinsic factors contribute to occupational performance. Intrinsic factors are stuff like neurobehavioral factors, psychological factors, physiological factors, spiritual factors, cognitive factors, whereas extrinsic factors are things like social support, social and economic systems, culture, values, technology, and environment. When documenting under PEOP, Your evaluation report should reflect the client's assessments or assets and limitations in relation to his or her occupational performance, as well as supports and barriers in the environment. Your progress report under PEOP should demonstrate the client's occupational performance within the environmental context. And your goals should be short-term goals, and they may relate to intrinsic factors inhibiting occupational performance, and long-term goals may relate to functional performance of daily life tasks and roles. Next is the proprioceptive neuromuscular facilitation frame of reference, or the PNF, which basically states that weakness and lack of voluntary control over movements are the main obstacles to normal movement patterns. And they believe that frequent repetition and stimulation of the proprioceptors support the learning of new motor abilities. They also believe that movements are more often diagonal than linear, so they want to focus on doing that. And they also believe that vision, breathing, and verbal commands all play a really strong role in movement. When doing documentation under PNF, your evaluation report should emphasize observable movement patterns. Your progress report should reflect client responses to inhibition and facilitation techniques, so what worked for them and what didn't. And your goals under PNF should relate to clients' movements during activities of daily living. Next is the rehabilitative frame of reference, which states that the aim of this frame of reference is to increase independence by providing environmental adaptations and compensatory strategies. Under this frame of reference, you need to consider the client's roles and the tasks the client considers essential for satisfactory performance of these roles. Documenting under the rehabilitative frame of reference, your evaluation report should emphasize both strengths and areas that the client needs to improve. Your progress report should document what types of adaptations have been tried and the results of each trial. And then your goals should reflect functional outcomes and what the client will do. The last frame of reference we wanted to go over was the sensory integration frame of reference. And this basically states that sensory dysfunction is a result of failure of the brain to properly organize and interpret sensory input. When documenting under the sensory integration model, your evaluation report should focus on identifying areas of sensory processing deficits and how these impact participation in everyday activities. Your progress reports and goals should reflect the child's responses to different sensory experiences, qualities of movement, and changes in the client's participation in everyday life activities.